The COVID-19 pandemic has brought the world face to face with a never-before-seen crisis. The virus doesn't discriminate between the rich and the poor, but its impact does. The United Nations in Bangladesh is mobilizing all agencies in supporting the government in responding to the pandemic and the consequences of the virus.
We're working with the Ministry of Health and other partners to ensure the best possible health response against coronavirus pandemic for limiting the number of infected people and saving lives.
Our focus is food security. We're working with the government to support smallholder farmers and food producers to ensure that they can continue to feed their families, their communities, and the nation as a whole.
IFAD is working with government partners to try to ensure continuation of food production and distribution to markets.
Our focus is inclusive and sustainable industrial development. We are working with government, MSMEs and other actors of the value chain to assess effect of COVID-19 and propose smart solutions for manufacturing sector to help them to recover in an inclusive and environmentally sustainable manner.
At UNFPA, we are serving tirelessly to make sure that every pregnant mother and every childbirth is safe during this pandemic. We are also working our hardest to make sure that every home is a safe home for women and girls.
We are helping vulnerable and marginalized groups of women receive life-saving information and connecting them with relief and support services. We are reaching out to women to listen to their needs and reflecting them in the COVID response policies and plans.
We promote and share quality educational program content and distance learning tools to hard-to-reach children, youth and adults. We are creating platforms for people to have access to art, artists and cultural providers.
So as IUM in Bangladesh, our COVID-19 response focuses on three main areas. Cox's Bazar response, the Rohingyas, 2 POEs, points of entry, and 3 migrant support and recovery.
We're working along several tracks. One, we're communicating with the communities to tell them the steps that they need to take to protect themselves. We're upgrading the healthcare response to ensure that there are isolation and treatment facilities for people who become ill. We're ensuring that people have the possibility to wash their hands and have access to water.
Basically, we are trying to work on 3 or 4 important areas. One is able to count and compute the costs of this outbreak because the socioeconomic costs of the outbreak are actually far outweigh the public health costs. The second is reaching out to unreached people who are now facing additional vulnerabilities because of the outbreak. The third is in reducing collateral costs of the outbreak. And finally, in all of this, trying to ensure that some level of social stability can be preserved and social tensions can be addressed.
Across the United Nations, our goal is to make sure that we soften the impact on the most vulnerable groups, to make sure that the voice of women and youth and those who are in the risk of being left behind are heard. As the United Nations, we put human rights at the center of all our activities. As the United Nations, we believe that together we can beat this pandemic.